Welcome to another FRG video. Today we'll be learning how to do a
PERRL test.
Yes, so PERRL stands for pupils are equal, round, and reactive to light.
You use a PERRL test to determine any neurological issues. It kind of gives you a hint on the stuff like neurogenic shock, ICP, stuff like that. You can also use it in medical scenarios for drug overdoses, and depending on the type, they'll kind of present differently.
So for example, for stimulants, your pupils will be dilated, which means they get bigger. And if the patient is on depressants, for example, they will be constricted, meaning pinpoint and really small. All right, to do a PERRL test, you'll be using a pen light. But if you don't have that available, you can use the regular flashlight or the flashlight on your phone. So this is what I'm gonna use. Make sure it's not too bright because you don't want to blind your patients. So you can start off by going in the patient's right eye and just shining that light through it. I'm checking to see if it constricts because once the light reaches the eye, it should constrict. And I'll do the same thing on the other eye, and it should have the same behavior. Now I'm gonna ask the patient to close her eyes. Now, open your eyes. I'm shining the light at his right eye, but I'm looking at the left eye. I'm looking for consensual pupillary reflex, meaning that both eyes are behaving the same way. And it should be constricting as well on this side. I'm gonna ask the patient to close her eyes again. And I do the same thing on the other eye. Can you open your eyes? And I'm looking at his right eye this time. And that's how you do a PERRL test. Thank you so much for watching this part.
All right, so we're going to go ahead and start the halo test. And the way you do a halo test is with a piece of gauze, just like this. Square gauze is better, but it doesn't really matter. It's up to how you do it. What you're going to do first is you're just going to fold it, and then you're going to fold it again. And you see this inside corner right here, that's just kind of all folded around. You're just going to dip it in the surface, just like around the patient's nose or ears, wherever the fluid's coming out of. And you're going to take it, dip it, and you're going to unfold it just like this. And you should see just like a circle of blood. If there is like a ring-ish of like lighter fluid around it, that's cerebrospinal fluid, and that's a good indicator for stuff like neurogenic shock, anything that has to do with the spine. So if you see this, you would definitely consider C-spine, and you'd kind of be on the lookout for any of those kinds of conditions. So we're going to go ahead and perform it right now. So let's just say for Sophia here, if the fluid is coming out of her left ear, I'm just going to kind of dip it in there where I'm expecting blood to be, and then I would take it out, and then just kind of watch to see if you get that ring around the blood. And if you do, then that would be considered a positive test, and then you would kind of just note that. And if you don't see anything, you just see blood in a circle, then you would just say it's negative. Yeah, that's the halo test.
Thank you so much for watching. Go to reviews.